D'Souza Institute and the Community Health Nurses Initiatives Group, CHNIG. The seminars offer an opportunity for professional development to nurses working in all domains of practice, be it community or acute care. The chosen topics focus on current issues and provide a means for knowledge transfer, discussion, and resources to apply to practice. If you have any questions throughout this presentation, feel free to email me. I will provide my email address on a slide at the end of the presentation. So to review the objectives for today's seminar, first of all, we will review the values and principles of primary health care and how they relate to community and acute care nursing practice. Then I will explain the differences and similarities between primary care and primary health care. And finally, I will discuss the key concepts related to primary health care reform in Canada. If at any point throughout this presentation you have any questions that you would like to raise, please write them down and email them to me. Each of you will come to this presentation with varying levels of knowledge on primary health care. I will try to give a broad overview so everyone can get a better understanding of what primary health care means, both in the local Canadian context, but also on a global scale as well. What do we mean when we refer to primary health care? Depending on where you practice nursing, primary health care may be a term you use daily, or it may be a term that you never use at all. It has a very long tradition, but many people, including healthcare providers, government officials, and the general public, have very different understandings about the term and may be confused when they hear primary health care being used interchangeably with the term primary care. I will discuss the differences between the two terms later on in this presentation, but for now, I would like to start with an overview of the origins of primary health care. The World Health Organization defines primary health care as being essential health care based on practical, scientifically sound, and socially acceptable methods and technology made universally accessible to individuals and families in the community through their full participation and at a cost that the community and country can afford to maintain at every stage of their development in the spirit of self-reliance and self-determination. In essence, primary health care is both a philosophy and a model of improving health care. It focuses on individual and community strengths and needs, involves the entire community in health care, includes all relevant sectors, but tries to avoid duplicating services, and uses only health technologies that are accessible, acceptable, affordable, and appropriate. Primary health care has been internationally accepted as being the most effective way to meet the health needs of all people in the world. I feel it is important to start with a historical overview of key documents which have influenced the development of primary health care since the 1970s. This will help to clarify the role of primary health care, both within Canada and globally. Starting in 1994, Marc Lalonde declared that the health promotion, prevention, biology, environment, and the environment were the backbone of health in Canada. This was the first time a major industrialized country stated that biomedical interventions, such as physician services, hospitalization, and medications, were not the primary factors responsible for individual well-being and improvements in community health status. This report had a significant impact on strides towards primary health care. In 1978, this is when the Declaration of the Alma Ata was introduced. This declaration recognized the inadequate state of the world's population and sought to achieve health for all by the year 2000. The Alma Ata Declaration outlined 7 parameters of primary health care, specifically that health care needs to be: number 1, the first level of contact with the health system; 2, accessible, close to where people live and work; 3, participatory and empowering, which encourages individuals to take more responsibility for their own health, including community self-reliance and self-determination; Number 4, affordable. 5, identifying those at risk and ensures illness prevention, health promotion, treatment, and rehabilitation. 6, providing service through multidisciplinary teams and intersectorally. And 7, it's based on practical, scientifically sound, and socially acceptable methods and encourages appropriate uses of technology. In 1986, the Ottawa Charter for Health Promotion was based on the Declaration of Alma Ata. The Ottawa Charter states that health promotion is the process of enabling people to increase control over and to improve their health. To reach a state of complete physical, mental, and social well-being, an individual or group must be able to identify and to realize aspirations, to satisfy their needs, and to change or cope with the environment. Health is therefore seen as a resource for everyday life, not the objective of living. Health is a positive concept, emphasizing social and personal resources, as well as physical capabilities. Therefore, health promotion is not just the responsibility of the health sector, but goes beyond healthy lifestyles to well-being. So continuing on to 2002, the Romanov report recognized that the Canadian healthcare system was placing too much emphasis on technology and illness, which was not necessarily increasing the overall health of the Canadian population. Romanov stated, primary healthcare is the single most important basis which to renew the healthcare system, which led to the initiation of healthcare reforms in Canada. In 2008, the World Health Organization renewed its commitment to the primary healthcare agenda with the release of the report, the World Health Report, Primary Healthcare, Now More Than Ever. I now have a video to show you. This video provides a historical and global overview of primary healthcare, and I will just set it up right now.
In September 1978, representatives of 134 countries, 67 international organizations, and many non-governmental organizations got together for the first international conference on primary health care. The meeting in Alma-Ata, Kazakhstan, was convened by the World Health Organization and the United Nations Children's Fund to discuss what seemed a worthy but unachievable goal, health for all, by the year 2000.
Salud para todos es fundamentalmente.
Health for all is basically a social goal, but even more a political goal, because health for all is a response of the world's countries to the great inequalities in health status among different peoples.
I think that everybody got to Alma-Ata with a clear idea of what they wanted to achieve. They were sharing great concerns for the disparities, for the unacceptable inequalities between the rich and the poor.
By the 1970s, a number of developing countries had been experimenting with new ways to tackle health problems with limited resources. That was the basis for what became known as primary health care, a way to see health as much more than simply treating disease.
Salud es ver las condiciones.
Health means healthy living conditions, preventing specific risks and preventing specific diseases, and curing and rehabilitating people, but doing all this in an integral way.
Sino todo en una forma integrada.
The concept of health for all was a social call to action.
People had a lot of enthusiasm. They were building on the experiences of hundreds and thousands of communities and village and health workers and political leaders. they wanted really to push for a new economic order that would be fairer, that would be based on social justice.
Health for all to me means that everyone has access and all the rights that go along with providing humanitarian assistance to everyone, regardless of race, ethnic background, and socioeconomic background.
Not all goals were achieved, to be sure, but many achievements followed Alma Ata.
It was an aspiration of the peoples of the world. And in that sense, from my standpoint, it was successful.
I don't think it's fair to say that Alma Ata failed. I think it's fair to say, however, that there were higher expectations that were not realized. Nevertheless, there have been advances, but it is time to recommit. Indeed, I believe the world has recommitted. It's recommitted through the Millennium Declaration and the Millennium Development Goals, a number of which are anchored in basic health, reducing child mortality, improving maternal health, access to clean water.
Whatever progress there was, though, was clearly not enough.
Hoy día,
Today, the injustices are even greater. So the justifications for adopting an integral approach to health for all are even stronger now than 26 years ago.
26 años.
I think the way forward when it comes to healthcare is to understand that there is a right to basic health. There's a children's right, there's a human right, that everyone deserves basic health care.
After 25 years, at least for this region of the Americas, the disparities have grown wider. And that's the reality that we face today.
The time has come to rescue the lessons from Alma Ata with an eye toward the future.
The reach of technology is so vast, and technology is getting so cheap, that I think that putting technology or using technology for improving access and improving care is going to change the world in a revolutionary way.
The Pan American Health Organization is ready to act and work with all countries to finally make health for all a reality.
So PAHO has been following and supporting the countries to keep that vision alive.
Yo creo que hoy día tendría que
I think it's time for a new collective agreement among all the countries calling for integral care for all. And there's something very important that should be added, and that is by all. Because the responsibility and duties of healthcare do not belong only to the state or to certain institutions, but to everyone. In families, in schools, in the workplace, everywhere.
Sorry about that from the beginning, that I had to restart that. So this was a video from the Pan American Health Organization, or PAHO, which is the regional office of the World Health Organization. And I thought this was a good video so you could see the long history of primary health care globally. And I want to note that primary health care has made tremendous progress in less developed countries, but it still continues to be the most effective approach to provide health care in all countries in the world, including Canada. So now we will move on to an explanation of the principles of primary health care. The 5 principles are accessibility, health promotion, public participation, appropriate technology, and intersectoral collaboration. And this is listed from the Canadian Nurses Association. The foundation of these principles is to achieve health for all, which relies on social justice and equity as key values. Social justice is based upon equal opportunity for health, which is created by economic, social, and political structures. In every society, all people, regardless of their race, gender, sexual orientation, economic status, religious beliefs, age, or mental and physical health, should be able to receive equal opportunities to meet their basic needs for existence and for their own health. When these needs are not met, inequalities arise, which creates social injustice or a violation of basic human rights. Equity in health refers to the fair distribution of health services to all people. An example of social injustice and inequity in health in Canada is the fact that rich Canadians are healthier than poor Canadians. So we'll go on to discuss the first principle of accessibility. Accessibility means that health care is universally available and that there are equal opportunities to receive health care regardless of where a person lives. Like I said before, their gender, age, race, income, employment status, language, and even their functional ability. Number two, that health professionals are distributed to all areas of Canada, whether it's rural, remote, or urban communities. And thirdly, that the appropriate type of healthcare is available from the appropriate healthcare provider in an appropriate time frame. So in order to apply the principle of accessibility into your nursing practice, the nurses that are working both in acute care and community care can ask themselves questions such as the following. How did the person I'm working with get here? And how difficult was it for this person to commute? Did they use public transport? Did they come from a remote town? How much does parking cost? How much does gas cost? Can this person afford transport and parking? Is the site wheelchair accessible? Are services provided in the language that this person needs? Are brochures and pamphlets prepared in an appropriate manner to meet the health literacy level of the reader? Are the hours accessible for the person to get to the appointment? Did they have to miss work to come to the hospital or to the community health center? Does the person get reimbursed if they miss work? How much does medication cost, and can lower prices be sourced if needed? These are all types of things that you need to consider when thinking about the principle of accessibility in your workplace. The next principle is health promotion. Health promotion is more than physical and mental health. It takes into account the social, economic, environmental, and spiritual factors involved in health. Health promotion strives to enable people to improve their own health and well-being through health education, nutrition, sanitation, maternal and child health care services, immunization, and the prevention and control of diseases. In your own nursing practice, you can try to address this principle by asking yourself questions such as, are there any social, economic, or spiritual or environmental factors influencing or hindering the health care of this client? Are health education and promotion initiatives incorporated into your care? What community resources are available for this person to support them? The next principle is public participation. Public participation encourages individuals and communities to be involved in the decision-making about their own health. The specific needs of each community are identified and addressed accordingly. It's a bottom-up approach which views clients as experts of their own care. So you can think about it your own nursing practice, and you can ask if the individual or the community that you're working with has been involved in the decision-making process for their health programs or their interventions that they're receiving. Are these interventions or programs meeting the needs of the community or an individual, or are they dictated by the healthcare professionals providing the care? Is the community working in partnership, or is it just listening to what professionals tell them to do? So the three things that you can think about in public participation is if individuals and communities are involved in decision making, the needs of the communities if they're identified. And the last thing is a bottom-up approach. And this is where the decision-making power lies with the individuals themselves rather than with the healthcare providers. The next principle is appropriate technology. Appropriate technology recognizes that modes of care need to be adapted to the social, economic, and cultural development of the community. New and innovative models of healthcare need to be developed and tested with the results published and disseminated appropriately. It requires ongoing capacity building and professional development. Questions you can ask yourself in your practice setting are, is this the most effective way of dealing with this health issue for this client? Does this client know how to safely use equipment if they need to use it at home? Are health professionals being used in the most cost-effective way in treating this individual or community? The next principle is intersectoral cooperation. So intersectoral cooperation looks beyond multidisciplinary health teams, which is usually just from the health sector, such as nurses, doctors, social workers, pharmacists, physiotherapists. But it starts to incorporate experts from other sectors, such as housing, education, employment, and immigration, among others, in order to meet the health needs of individuals and communities. The aim is to strive to achieve healthy public policies overall. So again, some of the questions you can ask yourself in your workplace are, what other professionals could be involved in supporting this client, be it another health care professional or a non-healthcare professional, and helping them to deal with a community level health issue. What services are available in that community, and how can these services be accessed for the client? So I'm going to go on now to discuss the differences between primary care and primary health care, because there seems to be a lot of confusion about these two issues. So primary health care refers to an approach to healthcare and a spectrum of services beyond the traditional healthcare system. It includes all services that play a part in health, such as income, housing, education, and the environment. Whereas Health Canada says that primary care is the element within primary health care that focuses on healthcare services, including health promotion, illness and injury prevention, and the diagnosis and treatment of illness and injury. So to make a little bit clearer of an understanding, I've given a little chart that discusses the differences between primary care and primary health care. So we can see the differences between primary health care and primary care in this chart. First of all, primary health care has a community focus, which looks comprehensively at broader factors which influence health, rather than having a narrow individual focus. Primary health care emphasizes health promotion and preventative health measures, whereas primary care rather looks at curative measures and treatments. Primary health care promotes community participation and engages the clients as true partners in their own health, rather than the primary health care approach of professional dominance and care being only driven by service providers. Finally, primary health care is intersectoral, as I explained before, and reaches beyond the health sector to achieve health and wellness, whereas primary care is focused usually at the multidisciplinary team in the health sector only. So now I'm going to go on just to give a brief overview of healthcare reform in Canada. So healthcare reform has been seen because of the escalating costs of Canada's universal healthcare system. And primary healthcare has been deemed to be the best way to maintain the viability of the Canadian healthcare system because of its focus on preventing illness and injury. So governments need to start shifting their thinking to upstream thinking rather than downstream thinking. And this is what looks at preventative health medicine. So Canada's universal health system, which began over 40 years ago, is facing increasing challenges requiring all levels of government, federal, provincial, and municipal, to recognize that action is needed to remain responsive to Canadian consumers and to curb escalating costs. Primary healthcare reform is felt to be essential to maintain the viability of the Canadian healthcare system. Primary healthcare is about transforming the way the healthcare system works today, taking away the almost overwhelming focus on hospitals and medical treatments, and breaking down the barriers that too frequently exist between healthcare providers, and putting the focus on consistent efforts to prevent illness and injury and improve health. These were comments made by Roy Romanoff in the Romanoff Report of 2002. So this is about shifting the focus upstream or earlier in the healthcare continuum, before individuals get sick or injured and seek urgent medical interventions. Services are not limited to a physician's office, but rather they can occur in an assortment of settings, such as health clinics, schools, and community health centers. A wide variety of health professionals provide services at this level, including physicians, nurses, dentists, pharmacists, social workers, occupational therapists, and physiotherapists. They can also collaborate intersectorally with other professionals. Care at this level not only includes the diagnosis and treatment of the problem, but it also can incorporate other focuses of primary care, such as rehabilitation, supportive medicine, supportive maintenance, health promotion, disease prevention, as well as social integration. Services can include fall prevention programs, well baby clinics, telephone helplines, immunization programs, or school screening programs. So in closing, I have another short video to show you. And this is a video entitled Canada's Community Health Centres Flying Together. And this describes the evolution of community health centres across Canada. So this video was chosen because one way to achieve an increase in primary healthcare services through healthcare reform is through the implementation of alternative services such as community health centres. This short video describes this evolution of community health centres across Canada, and you can note that in Ontario, we have come a very long way. So bear with me while I just set this up for you.
supposed to place emphasis on preventive medicine. This place didn't exist right on the streets. I didn't have my kids. My life would be downright important.
And the rest of the healthcare system was the same, where in a place like this, we're partners in our own healthcare. What if we created a new one? What if we said we're going to do this from the start? What if we created a mission that goes something like, if we build it, community health centers, they go where others fear to tread, and I have enormous admiration as a result. So we can understand the social determinants of health, then we can do so much more. And here is really very, very important. It's good for the community. Everybody matters. We tell the people to make sure that everybody has access to things like this. Just because getting the help when you need it, not when you're in major trouble.
If I had any message at all for anybody in the community, I would say maybe continue to pursue the community health center approach. It's a part of that community, and you're reaching out to make life better for them through housing, streets, and healthcare. This is the great thing about the CHCs here in Ontario and across Canada. Right. Okay.
So thank you. That ends the video. So the primary way to increase primary health care is, we were saying, through these community health centers. That's one particular way. And I hope that that was a good wrap up to this presentation. You can see below some of the references I have used. You can refer to these. If you have any questions, please email me. And if you would like a certificate, you can get one by completing a survey at the following link, and one will be emailed to you once you've completed it. And if you'd like to view any of the archived seminars, you can do so at the link at the bottom of this page on the CHNIG website, but it's also available on the D'Souza website. Thank you very much for your participation, and I hope you enjoyed this. Goodbye.